Hello, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH Core. It is my pleasure to welcome you today to our webinar titled Dialogue with Delta Dental of California, How a Delta Dental Plan Successfully Implemented the Phase 1 and 2 CAQH Core Operating Rules. This webinar is co-sponsored with NDETIC, the National Dental EDI Council, and we are very happy to be working with them to educate the dental community on the benefits of implementing the CAQH operating rules, as well as the value of core certification. I'd like to mention a few logistical items. You can download a copy of today's presentation from the caqh.org website in a day or two. It's not there now, but will be posted in a few days. In addition, a copy of the slides as well as the webinar recording will be emailed to you in the next few days as well. We will make sure to save time at the end of today's program in order to respond to your questions. You're encouraged to submit your questions at any time during this webinar by typing them into the questions panel on your dashboard. I'd like to thank our guest speakers from Delta Dental of California and NDETIC. We will introduce them formally a little later in the program. In slide number 4, you'll see our agenda for the day. We'll start off with a presentation on the CAQH core operating rules and core certification. Then we will move on to our guest speaker presentations from NDETIC and Delta Dental of California. After that, we will take some time to dialogue with our speakers as well as an additional speaker from Delta Dental of California. So let's get started. I would like to introduce our first speaker, CAQH Core Manager, Taha Anjarwalla. Taha?
Thanks for the introduction, Jessica. So we have a great presentation for everyone today. And I'll start off with talking about kind of generally an overview of the CAQH core operating rules, and then dive into a little bit about the certification program we have for the operating rules that have been developed by the industry. So next slide, please. The CAQH Core's approach towards operating rules is a holistic and integrated approach, starting from a staged process of rule development, which involves in-depth research on potential rule areas to bringing industry minds together to collaborate and develop on and vote on requirements for operating rule areas. Core then promotes operating rules by then building awareness through education sessions like this one, and also Core offers a certification program for organizations to test for and demonstrate compliance where adoption can be tracked. Lastly, we continue to monitor industry needs for future rule developments in areas and requests for updates to existing rules. Apart from that, Core has its own governing board of directors with representation from providers, vendors, clearinghouses, payers, associations, and regulators. Our board is definitely a multi-stakeholder representation of the industry. Next slide, please. So the purpose of operating rules is to build upon the HIPAA-mandated transactions for eligibility, claim status, EFT, ERA, prior authorizations, claims that really impact providers. From the original HIPAA legislation back in the late 90s, the goal of the legislation was to enable providers and health plans through these business processes through the use of transactions via standards. But over time, it was discovered that standards were being used in a variety of ways. So CAQH worked with a multitude of stakeholders across the industry to develop operating rules to complement the existing standards. So transactions could be used exactly the same way across all payers within the provider networks. There are two main components of the operating rules, which include first, infrastructure requirements, such as response time for transactions or the use of the acknowledgements within the transaction. Infrastructures apply across all transactions that the Core has operating rules for. The second component is data content, which designates requirements for valuable data that a transaction can support. An example of this would be a return of patient financials for key services and benefits when an eligibility inquiry is sent. Next slide, please. So in relationship to the development of the operating rules, we currently have participation representation from over 130 organizations that represent a dynamic group of stakeholders across the healthcare industry. From a dental industry perspective, there's representation from Delta Dental Plans Association, as well as participation from many of the large commercial players that offer dental coverage as a business line. So we have a lot of dental stakeholders involved with developing the operating rules. As CAQH Core progresses with the maintenance and development of future operating rules, we encourage and invite those other dental stakeholders to kind of have a seat at the table. And to kind of give you an update where we are in the process of gearing to launch a subgroup to discuss opportunity areas for the prior authorization transaction. So if you're interested in participating, please contact us at Core, and we'd be glad to kind of involve you in the process. Next slide, please. So when looking at regulatory requirements for operating rules, covered entities are required to conduct transactions using operating rules for phases 1 through 3, which cover the eligibility, claim status, EFT, and ERA transactions. And also, HHS released a proposed rule that has not yet been finalized on health plan certification, so requiring health plans to certify on compliance with the operating rules for phases 1 through 3. Again, that still hasn't been finalized yet, so more to come on that. And with phase 4, the operating rules cover the 278, 820, 834, and 837 transactions, and these have not been federally adopted and are currently on a voluntary implementation basis. So as dental payers and some clearinghouses are HIPAA-covered entities, they are required to be compliant with the mandated operating rules. And we've actually had dental-specific plans actually complete core certification of the operating rules to kind of help test their systems and demonstrate compliance to these rules. Next slide, please. So as core certification coverage continues to grow in the marketplace, core certified entities should be experiencing the benefits afforded by the use of electronic transactions and the operating rules. According to the findings by the 2016 CAQH Index, it's estimated that $1.9 billion can be saved through the use of eligibility, claim status, EFT, ERA, claim submission, and prior authorization transactions, which are all transactions covered through the operating rules for phases 1 through 4. And this $1.9 billion saving estimate represents only costs related to direct labor. So as more organizations across the industry transition to fully electronic transactions and adopt operating rules to experience administrative efficiencies, there's more potential for this cost savings to be realized. There's more room for the industry savings on areas such as indirect labor costs, vendor and other overhead, and the inclusion of transactions such as enrollment and premium payment, and also cost savings from the public sector, which are not included within this study. Next slide, please. So as illustrated on this slide by the graphs, the CAQH index finds that there is steady but modest progress with adoption of fully electronic transactions for commercial dental plans. The dental industry adoption trends are fairly positive, but when we compare it to the medical side, about 30% lower in the adoption rate in that transition to fully electronic. So we do have some room for the dental industry to grow with adopting electronic transactions, and hopefully through education and certification, we can kind of drive that adoption forward. Next slide, please. So next up, I kind of gave an overview of kind of where the operating rules are at, kind of the current status, and the potential cost savings through implementation of operating rules and electronic transactions. So next up, I'll talk about voluntary certification to kind of show how you can actually show conformance and demonstrate adherence to those operating rules. So as a program, voluntary core certification is really the gold standard in how a health IT certification program should be developed and administered. This slide outlines the elements that make up a kind of checks and balances that make the core certification program unique. We think that the most important element of the program is that the actual requirements that are necessary for an entity to demonstrate conformance with the operating rules, the actual test questions are developed by industry representatives like the organizations out there on this call, and those requirements, those test questions are put through the same thorough review process that the core operating rules go through. So they are voted on by entities that actually conduct the transactions. So core certification is the industry deciding for itself what conformance actually means. Next slide, please. So as part of certification, we're always interested to learn why an organization decides to pursue core certification and what are the value-added benefits. Outlined here are common themes we heard within the stakeholders from both the dental industry and also other stakeholders as well. Foremost, since there are a few core certified dental stakeholders, we've heard that certification actually positions themselves as the industry leaders in demonstrating administrative efficiencies. Another common benefit we hear from dental payers is that pursuing certification helps to prove to network providers their ability to commit to and streamline the revenue cycle management for provider practices. And lastly, I'd like to point out that almost every entity pursuing certification states that certification testing and the issuance of a core seal helps their organizations give their organizations assurance that they're compliant with federally mandated operating rules and allows their organizations to feel comfortable in the event of an audit. Next slide, please. There are many benefits that make core certification stand out as a gold standard in HIT. The certification program is a multi-stakeholder, collaborative, and industry-driven effort that provides benefits from both an industry and an organizational perspective. From an industry perspective, the elements of the certification program were developed by industry stakeholders through the core voting process, which I described earlier. Another great benefit of the certification program is that each phase of certification builds up to other. So if you implement and certify on one phase of the operating rules, you can leverage your past efforts to implement and certify on future phases of the rules. Each phase of the rules, phases 1 through 4, share a common set of infrastructure requirements that apply across each transaction, including requirements around connectivity, security, response time, system availability, campaigning guides, and acknowledgement. Thus, if you implement one phase, you have already created a foundation that will help streamline implementation of subsequent phases. Another key benefit we hear from organizations as to why organizations decide to pursue certification is conformance. So certification is like using TurboTax or going to H&R Block or even going to a third-party accountant to help you with your taxes. It's a good practice to find somebody outside of your organization to check your work to make sure you did it right. And core certification is that kind of checks and balances for the operating rules and underlying standards. Next slide, please. So moving on to the next slide, we're happy to announce that we have awarded 323 core seals. And as you can see on the slide, we have issued several dental-specific certifications to organizations like Delta Dental of California, who we'll hear from later today, Dentegra, HealthFlex, and further, some of the large commercial health plans such as United, Humana, and Aetna have certified their dental business line. So there's lots of great covered lives that are covered by dental certifications. Which brings me to the next slide. So CORE recently conducted a market study on the industry progress for operating rule implementation via tracking adoption through certification. So this slide compares findings between medical and dental payers. Compared to the medical side, where phase 1 and 2 covered 76% of insured lives, dental plans represent about 34% of insured lives. So there definitely is a gap. I think we can see that mirrored from the findings from the index. And with phase 3, where the medical side covers 27% of insured lives, for commercial payers, certified dental plans represent 3% of insured lives. And again, there's a gap for phase 3, but again, that kind of resonates with the findings from the index. So in looking at the trends and comparing this to some of the index data, there's about a 30% difference in adoption rates for electronic transactions between medical and dental. And from what CAQH Core can see over the past year, we've seen an uptick in implementation questions as well as certification inquiries from the dental industry, which is promising with kind of hoping for a growing adoption rate in the future. So, moving on to the next slide, so I've kind of shown you the benefits, shown a couple of the dental plans that have achieved certification. So next I'll talk about is the step-by-step process in order, if you're thinking about certification on, what are the different components in order to become core certified. So there are about 4 components. Component number 1 relates to planning and evaluating systems prior to beginning core certification. Component number 2 relates to the signing and submission of the CAQH Core Pledge. So after an organization signs this pledge, they have about 180 days to complete core certification testing. Component number 3 relates to certification testing, which organizations must work with a core authorized testing vendor to complete testing requirements to demonstrate their conformance with the rules. And we work together with our testing vendor to ensure they're able to accommodate test cases for the dental industry. And component number 4 relates to the application process for the certification seal. This involves a submission of an application form, attestation statement that your organization is HIPAA compliant. And after you complete through these 4 steps, we have a thorough review process. We'll review all the application materials, your test results, and ensure there is a comprehensive review done and award you a core seal once everything checks out. The next slide, please. So to kind of help you kind of start, when you start thinking about certification and start looking at how to do system remediation, during the pre-certification and system evaluation phase, we recommend organizations review and understand the requirements of the operating rules and scope resources needed to adopt and implement these rules. And so in a very important resource that CORE offers is the analysis and planning guides. So we offer these for every phase, phases 1 through 4, with a separate guide for each phase. The guides have separate tools within it, so not only can you do a quick assessment, or you can do a simple check yes or no, identifying if a general operating rule applies, such as does my organization do real-time or batch. And further, the guide also offers drill-down tools where you can check operating rule requirements line by line, determining whether or not they apply. Is it a business impact? Is it a technical impact? And this helps you identify remediation strategies, such as, do I need to make a software change, business process change, or even add an education or communication opportunity within your organization, where you may have to engage with another department area or possible trading partner. So this tool is very valuable and it helps you map many touch points between systems and business processes to help streamline the implementation of the rules. And I'd like to highlight that, this tool and all our other resources are available free on our website. Next slide, please. So in order to ensure the dental industry is able to see cost savings and maximize the benefits afforded by the operating rules and use of electronic transactions at $1.9 billion, core certification requires dental plans to outsource components of the EDI processing to vendors and clearinghouses to work together to ensure there's conformant data flow between all trading partners, which is then downstream enables providers to take advantage of the operating rule benefits. So if you're thinking about core certification and if your organization does outsource operating rule components to a vendor, it's important to note that vendor must become core certified before your organization can achieve certification. So if you'd like to learn more about certification, operating rules, or any of the other topics I covered today, feel free to reach out to us, and I'd be happy to set up some time to talk with you further. So with that, I'd like to hand the call back over to Jessica.
Thank you, Taha. Thank you for that presentation. And Taha has just shared an enormous amount of information with you. In addition to the analysis and planning guide that he mentioned, our website also has FAQs that are listed by operating rule phase and can also be searched by keywords. So that's another valuable source of information. And as Taha said, if you have any questions, please contact us by email and we would be happy to help. So now let's get to our first polling question. What we would like to do now, besides just shift gears a tiny bit, is kind of see where you, our audience, is in terms of certification. And this information will help us if there's any follow-up information that we could provide to you, and also get a sense of where you are so that we can provide future education sessions that are more tailored to your needs. So let's launch this poll. And as you can see, we are trying to hear what resonates. What are the reasons that you think are the most important when you're pursuing course certification? And if you're not sure or you're in the starting stages of learning about it, please click that number 5 or specify in the questions panel, because we want to make sure that we respond to your questions and needs. So we will close the poll in 5 seconds and take a look at where we are. So we are going to share the results with all of you. And I can see that there's a large group of folks out there who thinks that reasons 1, 2, and 3 are equally important in making a decision to become core certified. I see a few others that have a little bit more, resonate more with you than others, and 0% others, so that's good. It means that these categories are the right categories. Taha, what are your impressions of these responses?
Yep, so it's kind of aligns with the current feedback that we hear from organizations that, towards the end of the certification process, we have some, why they certify, and, with the almost 60% kind of thing that all of the above, not only does it demonstrate conformance, but it also shows, your leaders and administrative efficiencies. And so it kind of resonates with kind of the feedback that we do here. So it's good news.
Well, thank you very much. We appreciate your input. And so now for our next presentation, I'd like to introduce Katherine Johnson, who's the chair of the Endetic Board of Directors, as well as director for HIPAA Product Services and Support at Delta Dental Plans Association. Kathy joined DDPA in January 2012 as the director of HIPAA Product Services and Support. She is the DDPA liaison to external standards industry groups such as CAQH Core, HL7, Endetic, X12, and WEDI, promoting the use and adoption of real-time adjudication and EDI processing transactions, and she is recognized as a thought leader in the dental external standards industry. Kathy is also the chair of the Endetic Board of Directors, as I said before, and she co-chairs Endetic's workgroup on eligibility benefits, co-chairs the WEDI dental subgroup, and acts as liaison to the Codes Committee for X12 Benefit Information Workgroup. My goodness, Kathy, I'm so glad that you are here since you have so many important roles in our industry. And Kathy, I will tell you on a personal note that I've really enjoyed our collaboration with CAQH Core and Endetic, and I'm really thrilled to have you here today. Welcome, Kathy.
Oh, well, thank you very much for that great introduction. Part of the Endetic support comes from volunteers. Our organization is totally volunteer-based, and so I would like to recognize our Membership Education and Conference Committee co-chairs who help us put this webinar together and collaborate with CAQH Core. That's Karen Camp of Change Healthcare, Damon Dunsmore of Benefits, and Jim Sheckelman of Delta Dental of Wisconsin. So thank you. Next slide. So the value of Endetic is represented in our mission and our vision statements. Endetic is a dental-specific multi-stakeholder organization supporting dental providers, payers, clearinghouses, practice management systems, and associated vendors. We share best practice information to promote the adoption of electronic data interchange and collaborate with organizations such as ADA, CAQH Core, X12, WEDI, and we represent dental industry issues and promote common solutions. We also hold various events throughout the year, and for more information about Endetic membership, you can go to our website, and once the presentation is made available, you'll be able to click through the presentation itself. Next slide, please. So with that, I'd like to turn it back over to Jessica. Thank you very much.
Thank you, Kathy. And Kathy will be joining us a little bit later in the program, and we're going to have a virtual dialogue and get to talk to her a little bit more. Our next presenter is Bernadette Ogden, Solutions Architect for the Enterprise Architecture Group at Delta Dental of California. Bernadette has over 25 years of technical experience in web and B2B development and implementation. She's a subject matter expert on compliance and regulatory requirements on dental and electronic transactions for dental dentals of California, New York, Pennsylvania, Delaware, West Virginia, DC, and Puerto Rico, as well as the Delta Dental Insurance Company, which covers numerous states, and Dentegra. We're very happy to have Bernadette here today to share her core certification story. Bernadette, welcome.
Thank you, Jessica. Hi, my name is Bernadette Ogden. I'm Solutions Architect with Delta Dental of California. And, Delta Dental California represents basically the, part of the member companies that comprise, dental companies that basically has approximately 35 million membership. So, we're one of the biggest dental providers, not just here in California, but basically within the Delta Dental Plan Association. So, next slide, please. Thank you. So basically, when we certified for core phase 1, phase 2 many years ago, it was a conscious decision from our management, executive management, that although at the time it was a voluntary certification, we want to be able to demonstrate that our system is, or our data exchange platform is very much in compliance with all the CAQH core operating rules. And we also want to standardize our end-to-end process integration with our trading partners, clearinghouses that integrates real-time 270, 271, 276, 277. So, I think that's one thing that, I want to emphasize to the team, that, basically, you really need to have your executive, sponsorship to be able to accomplish this, because the certification process is very time consuming, and I would say that it requires a focused effort, not just from the IT side, but also on the business side, to ensure that all the process we're doing is in compliance with the operating rules. And like I said, when we certify at the time, I think we're probably the first. I must say that we were probably the first dental insurance company that went through the certification process. So, at the time, we want to be able to be ahead of the curve. We want to learn more about, whether our system is actually compliant with all the operating rules. So it was really more of a trying to test whether, hey, is our system, following all the compliance rules. And our hope at that time was, when these operating rules becomes mandated, certification, then we will have all the learnings and basically system changes that require us to be able to support that compliance. Okay, next slide, please. Okay, so Tara has touched base on the certification process. So I just want to go through and share with you how, from Delta Dental California experience, how we went through the whole certification process. So I think from all the steps that was described by Taha earlier, I think the first step is probably the most time consuming, because we have to go through a lot of the requirements as far as core operating rules are concerned, one by one, to ensure that every single component of those requirements we are compliant with. And then also reviewing all the test cases. And I don't know, for some of you who has certified or gone to certification, in our case, we use Edifax as the third-party vendor. So we had to go through, all the test cases and, basically review whether, what data we have to provision in our system, go through all that process. So it took us a little bit of time to be able to do that first step, which is the pre-certification and system evaluation. And to some extent, we have, you have to make a lot of system changes to make sure that, we can basically certify and, be in compliance with all the test cases that we were provided with. Okay. And then the next step is basically when we sign and submit the core pledge. So this is what I was saying earlier, that it really helps to have an executive sponsor, whether it's the IT on the business side, to be able to support this process. Because without that, everything becomes less of a priority. And so in our case, we are a big organization with lots of resources, but we also have a lot of deliverables and priorities that obviously consume all those resources. So having that executive sponsor to support this effort really makes a lot of headway, at least for us, because it's always in their forefront of their mind that, hey, we have to complete their certification. So they're always pushing us to ensure that we can complete that certification. Okay. Now, in terms of the actual certification testing, so like I said earlier, we went through Edifax as the third test partner that we basically sign up with in order to get certified. So we have to work with them to set up the user accounts for both our developers and our testers, so that both of those resources can see what's going on, and then obviously the developers in their behalf will be able to exactly see what's going on and what system changes they have to do to ensure that we pass those particular test cases. Okay. When it comes to the testing defects resolution, obviously, our system that we're using is, we don't have an exclusive test environment that we use specific for the core testing. So, for us, getting the testing and the defects resolution takes a little bit more coordination, because we have to ensure that, we're supporting obviously our, business functionality, but at the same time support the testing effort. Okay. And then the test results, this is, I think when we were doing this initially for phase 1 and 2, I think the challenge for us is, every single test cases, you have to go through Edifax and, basically document every single one. So it's very, again, I would say it's time consuming, but at the same time, it's also provide us a lot of learning, because by probably test case 10, we're so used to it, right? I think the first test cases is a little bit more challenging because we're trying to get used to the process and how we document the test results and everything like that. But I think, by the time we're past test case 10 and, we're very used to it, and we already know how to, basically follow the process. So it became a little bit more easier from our perspective. Okay. Next slide, please. Okay, so some of the testing challenges we had to face with, like I said earlier, our test environment is not exclusive for the testing certification. As you probably experience in, a lot of IT organization, we, do a lot of releases and, that supports our business, functions and things like that. So we don't really have like a dedicated environment that will allow us to complete all the testing specific just for the core, because we also have to support other things. So I think from our perspective, the 180-day pledge window, I think it took us I think 2 or 3 times to I think extend that a little bit. So it took us more than 180 days, I could tell you. So I think it took us a total of probably more than 12 months to basically complete all the certification testing for phase 1 and 2. So that for us is a challenge because of the environment that are that's available to us, and also the supporting resources to address all the defects, all the deployments to be able to continue with the testing. That's also obviously shared with our regular business function. And then obviously with another third-party vendor, the Edifax testing support. I mean, they're very supportive, but I think, for us to be able to address any defects and, get a response from them. So there is, a little bit of time around, a little bit of the turnaround time that we have to, basically contend with in order to be able to ask any questions regarding a defect, resolve any defects and things like that. So that for us is a little bit challenging, but I think as time goes on, that becomes more of a regular process. So as time goes on, it becomes easier. Okay. And then this is one thing I want to share with you guys. Like I said, I think we were the first dental providers, payer that went through the certification process. So during the time we were testing, the STCs that were, being used for those test cases were mostly medical STCs, right? So for us, obviously, all our STCs are dental STCs. So we were, those test cases were failing because we weren't able to provide the right STCs for those specific test cases. So we ended up basically submitting, an exception request to CAQH, and they review that exception, and they understood that that was one of the limitations at that point in time. So we were able to pass that, but it's through an exception process. So I just want to point that out, that I don't know if some of you have gone through that same, challenges when you were testing for dental. But, I think that's one of the things that CAQH integrated into their test tool, so that that limitation is no longer, existing today. Okay. So we went through all the testing. I think there were approximately close to 40 test cases that we went through. Some of them requires actual documentation to prove that things are, that we're compliant with that particular test cases. Some are just making sure that we pass the particular test cases, and EDIFACT obviously will provide us a pass or a fail. So once we have all of those documentation, the next step obviously is the whole attestation, right? So we document all the test cases, all the test results, and then again with the attestation document. This is again where, I'm going back to the executive sponsorship. For us, it's very important that our executive sponsor also provide the attestation for the core seal. And once that's complete, then, there's a certain period of time that obviously CAQH review everything, and then we were granted the core seal. So for us, it's a proud moment, I would say, because not only are, although, we're kind of representing just Delta Dental California, but our, company is comprised of many Deltas, Delta Dentals, including DDIC, and we have a second brand called Integra. So I just want to point out that because we're using, and that's one of the things that I want to say, that from a, a cost saving standpoint, because we're using, a system that is basically standard for all these member companies that we basically support. Then for us, once you get through one plan, I would say, then that takes care of the other plans. And like I said, we also support Delta Dental in New York, Pennsylvania, West Virginia, DC, DE, Delaware, and Puerto Rico, and obviously the Delta Dental Insurance Company, which is a lot of states. So for us, that was, and then the second brand, which is Integra. So for us, that I think it's a leap from basically having proven that one company is compliant, and then we just adopted that for the other member companies. So for us, that was one of the big wins, and also the fact that from an infrastructure standpoint, when we were integrating with our trading partners, clearinghouses for the real-time transactions. And oh, by the way, I just want to let you guys know, we process approximately 40,000 transactions a day just for the 27X transactions. Okay, so this is, that's the minimum on a daily basis based on our current integration with our trading partners. So you can actually, see and gauge how much important this transaction is for us in terms of customer support, especially for our providers that are integrated with our trading partner or clearinghouse. So those type of, cost savings as far as having to move from a VPN connectivity with these trading partners to moving to an HTTPS infrastructure from a technical standpoint is a lot of cost saving, because now we don't have to maintain those VPN, which is very costly for us. So now everything goes through the internet and be able to access those transactions via, open internet. So obviously secured, but, that is a big cost saving for us, because we had to maintain those VPN connectivity for every single trading partners we have, which, part of the core is we were able to get rid of that as part of this implementation. So that, I think that was for us is a big cost savings. Okay. Anything else? I think Jessica, I'm done.
Thank you, Bernadette. Thank you, Bernadette, so much for your presentation. That was chock full of information, and we really appreciate you taking us through step by step your experience, including the challenges. And sometimes sharing those challenges is what helps the audience more as they're preparing either to think about course certification or they're in the process of beginning course certification. And I do want to emphasize, Bernadette, you mentioned the Delta Dental of California was the first dental plan to go through course certification. And because of that, you also paved the way for other dental plans and other dental stakeholders that are contemplating or in the process of going through this. So I guess your pain will help the others going behind you. So thank you very much. And now I'm going to be moderating this next portion of the webinar and talking to all of our speakers. In addition, we're happy to have another expert from Delta Dental of California who's going to join the dialogue. Christine Ruiz serves as manager of professional relations in the network development division at Delta Dental of California. Christine has been in the dental industry for over 30 years in various stakeholder roles. She's built an outstanding reputation in dental office management, team building, leadership, and training the dental office staff in streamlining their own operations. Her focus in the dental industry includes providing technological training to educate and promote the use of EDI, and her approach to expanding EDI is to empower staff to take control of the insurance process in an online environment. So we'll begin the dialogue portion of the conversation, and given that Christine's background is in education and training, I thought I would start with her. So Christine, how much of a learning curve did you have to go through when the operating rule requirements were mandated by HHS in 2013 and 2014?
Hi, Jessica, and thank you for that welcome. So the learning curve wasn't too bad as we had direct access to multiple internal resources. We did encounter some challenges in ensuring that our systems could support the requirements. I think the other point to mention is the other aspect is being able to educate our dentists on the rules and what they mean to them and their businesses. I also feel that mentioning the fact, and I think Bern did a great job at this, is the multiple trading partners that we work with in the various ways that they approach the requirements was eye-opening for us in terms of, I think the core certification allowed us to level set and streamline processes more so than we had more custom approaches to exchanging information. So I think this certification really helped us streamline and really take advantage of the cost savings. I think the VPN was one of the things. So from a learning perspective, I think overall, we have quite a few subject matter experts within our organization. So for us, it was, we had the benefit of having that available to us, and then we shared that, of course, with our providers along the way.
That's really helpful to kind of see how the information sort of trickles throughout your organization. I'd like to ask the next question to Bernadette. And Bernadette, you mentioned this during your presentation, some of the challenges that were unique to, Delta Dental of California as first in course certification. So I wanted to ask you, were there any specific challenges that you can walk us through in remediating your systems to meet the CAQH core rule requirements? So for example, did you have to go through service type code remediation or any other types of specific modifications to pass the testing?
Yeah, I think, from a, connectivity standpoint, initially, obviously, when we made our system, compliant for core phase 1 and 2, our focus is really providing our trading partners with connectivity via HTTPS, right? Interchange. But I think for us to be fully certified, we also have to show that we could also support MIME, right? And which we don't use today with any of our trading partners. But for us, it's something that we had to do, although we don't have any trading partners today that require us to use the MIME instead of SOAP. So, but that was a good experience for us because again, apart from having to learn how to integrate with that particular connectivity, that's something that we had learned. So if in case one of our trading partners requests to basically connect with us using MIME instead of SOAP, then we will be able to support that as well. So that's one. And then, when it comes to the actual, test cases and things like that, I think one of the things that also, we learn, and this is something that, like I said, because we were using California first as one of our member companies going to certification, so that in itself, we modeled the other payers that we support along that line, but also on the phase 3 certification process. So having learned from core phase 1 and 2, I think phase 3 certification process, the testing took a little bit faster than obviously phase 1 and 2 because we're already used to the process, we're already used with what needs to get done and things like that. And by the time we know that our infrastructure is already compliant, right? So it's more certifying the actual transaction set, which is the A35. So for us, that was something that we learned a lot from and was able to leverage for core phase 3 testing as well. Okay.
That's very helpful, Bernadette. I really appreciate that. And so Taha, follow-up question for you. Have we changed our testing scenarios to better address dental industry stakeholders and their specific needs?
Yep. So when certification was first launched, test data kind of resonated more with the medical communities, and over time, we've worked with our testing vendor to be able to accommodate to a variety of scenarios specific to the dental industry. I think that Bernadette highlighted earlier in her presentation. So, for example, like service type codes and even some benefits specific to patient financials have been accommodated, and we're able to kind of work around those test cases. And as Delta Dental California, they were the first dental plan to become certified, so they were kind of helpful in paving the way at being able to take lessons learned from the dental stakeholders and dental community, and ensure that we evolved and kind of can create a more better user experience for dental stakeholders to come when they pursue certification.
Thank you, Taha. So another question for Christine. Were there benefits to choosing to core certify now rather than waiting for a mandate to certify?
Yes, absolutely. So from a compliance standpoint, we chose to pursue the voluntary certification to give ourselves the benefit of starting early, identifying potential system concerns, and having ample time to make changes as we went along. We certainly felt like being ahead of the curve was to our benefit and to give ourselves more time to adjust our strategy as needed.
That's great. Yeah, I guess it's better to do things on your own terms and based on what's best for your industry, your organization, as opposed to waiting for government to mandate what to do. My next question is for Kathy. So Kathy, in your work with Delta Dental as well as with Endetic, have you seen any patterns of information gaps or misconceptions in the industry that are keeping them from moving forward with operating rule implementation?
Yes, I've had a lot of exposure to this, and probably the greatest message that came across here today was the advantage of being able to certify on your own time and on your own terms. When I work with the various organizations that I work with, oftentimes payers, providers, even practice management systems look at these additional certifications and or mandated requirements as problematic to their business, when in fact, if we could encourage the leadership of organizations to look at these opportunities as in a broader context, meaning that even though there might be a mandated opportunity for having to comply, my position has always been, once you have that assignment, once you need to follow through on that, you limit your opportunity to be able to look at it more strategically because you're under the timeline of the mandate itself. So I think what we've heard today through the process that California went through was they had the opportunity to do that in advance of the compliance date, which then allows you to be a little bit more forward thinking and perhaps such as what was suggested is moving to HTTPS versus VPN. It just gives you those opportunities to look at your systems globally and reap the benefits of both the mandate requirements and also, add any additional strategic things that allow you to solve other business-related issues. So I was very pleased with the outcome of today's discussion.
Thank you, Kathy. Yeah, I think that was definitely a takeaway for me too. So Bernadette, in your presentation, you mentioned, some of your, pain points, and so what would you say to another Delta Dental or another dental health plan out there who's thinking about core certification?
I think based on our experience, and I mentioned this earlier on, is, I think you need to have an executive sponsor because, this is something that obviously us as a payer, as an organization, we take compliance very seriously. And so, we do have a team that really focus on, compliance requirements and, basically have a, the executives, not just from IT, but both business, to basically support those endeavors. So for me, that is one thing that I think anybody who's thinking about certification should really, have the backup of your executive management. And the other thing is, again, although in our case, phase 1 and 2 took a little bit more time, but I think, having that experience will allow you to, to support future, compliance. Like, for example, like I said, phase 3, that was something that, phase 1 and 2 is something that we leveraged when we went through phase 3 certification testing as well. So, my advice is, don't be, scared. It's really worth to test or try whether your system is compliant or not, right? Because it's now a mandatory, at least for phase 1 and 3. So, so it's really worth trying it out. At least, have the opportunity to really see if your system is compliant or not. And I think the test cases that we went through, I mean, I can tell you that when we complete all the compliance development system enhancements for core phase 1 and 2, we thought, oh, we went through all the steps, all the requirements, those PDF documents. We were so sure that, we were all in compliance. But when we went to certification testing, we're finding that, oh, we have to do this, we have to do that. So that was in itself a very good, learning experience in addition to our, what our system can support. So I think they should really try it out. I mean, that's my advice. But, you got to have an executive sponsor. You got to have this as one of your priority from a compliance standpoint. And I think, you should really, try to see and make it as a learning experience, because in our organization, like I said, compliance is a very high priority.
Yep, and to kind of dovetail off what you were saying, Bernadette, as far as kind of looking at developing a project plan and kind of figuring out what level of compliance and figuring out the scope of the resources and what you may need for testing, you can actually before you even begin the process of testing or even pledging, you can actually create an account and register with EdFX, and before you sign the pledge, before anything, to get a scope of all the different test cases, to kind of see what it's like. So definitely a good practice to do.
Yeah, and Taha, that's a very good point, and that's exactly what we did. Because, like I said, the first step is the most time-consuming, because that's where we found out that, oh, we're not doing this correctly. We got to fix that. So before we even signed the pledge and all of that, we went through all that assessment, I would say, pre-assessment of everything regarding our system. So that's how we're finding that, yeah, you did this, but you didn't really do this fully. So we were able to, basically enhance those capabilities and was able to get through all the test cases.
Thank you so much. And so for a last question for Kathy. So Kathy, are there other topics or areas of interest to the dental community that we could address in our future ongoing collaboration with Endetic? What else can we do to help the industry transition to more use of electronic transactions?
So in my experience, what we're finding and what was presented by Taha in the very beginning was that dentistry really lags behind medical when it comes to electronic transaction adoption. And partially because I believe that dentistry, unlike medical, doesn't necessarily have the same governance over its processes with CMS and some of the other restrictions that you have between hospitals and providers and electronic health records and things such as that. So I think really if we could focus on providing information that allows the provider community, in our case the dentists and some of the larger DSO or dental service organizations, recognize that the level of sophistication from payers and from the whole EDI implementation process has truly grown and is much more effective in today's world than it might have been when we first started looking into all these transactions on a mandatory basis. So we at Indetic spend a lot of time focusing on best practices guidelines. We really try to look at it from a dental perspective and try and build solutions that allow the provider to have some consistency in perhaps how we're utilizing EDI transactions. So we've got the Uniting the Industry Forum group that put together the top 56 questions, which is really trying to reduce call volume in the customer service centers for payers, and certainly an opportunity to reduce the time of the call and the resources that providers have to dedicate to getting eligibility and benefit information. The other lowest adoption area for us is electronic funds transfer and ERA. There's probably some myths out there about electronic funds transfer, and it makes the industry nervous about relying on that. So partnering with organizations such as CAQH Core and looking at your operating rule requirements and allowing some of the consistent interpretations to take place, that would be of value. And also keeping NACHA involved, which has the banking standards, because I do think there's concerns about sharing banking information and how you limit access and protect that information. So I think there's a lot of opportunities for us to collaborate. I know we're providing a lot of information across the nation with all the dental payers on trying to get some of the statistics out there that allow us to prove that there is a return on investment and prove that there are opportunities for dental practices to reduce their costs as well. So that would be, I think, quite a broad spectrum of opportunity. And last but not least, it's marketing. We spend a lot of time, and even today's session, we spend a lot of time on the how-tos of implementing, but we don't seem to spend as much time on trying to build marketing solutions on how to encourage providers to take advantage of it. So Indetic has tried to do this with a couple of sessions that we've conducted recently for EDI 101, and then how the providers can leverage it. So we've tried to do it from a payer and a clearinghouse and a provider perspective. But I think there might be more opportunities or perhaps more information available from the medical experience that we could adopt in dentistry to promote the opportunity for future webinars such as this, presentations and other organizations, and more collaboration.
Thank you, Kathy. And we've really enjoyed collaborating with Indetic, and so we look forward to working with you on some of those issues that you mentioned. I think that there's a lot of information that we can provide to the dental industry. We have a couple of audience questions that have come in, and so we'll take a few moments to answer those. The first question is, I think, for Taha. So Taha, the question is, to receive the core seal, you need to pass all testing for all the operating rules.
Yep, so that's definitely a good question. So the seals are specific to each phase of the operating rule. So there's a seal for phase 1, phase 2, phase 3, and each of those phases have operating rule specific and testing components specific to those phases. And I like to kind of point out, so if you're a payer or a provider, you would have to complete testing tasks that are relevant to kind of your business needs. So usually plans have to do kind of testing that identifies you as an information source versus providers as a requester of information. But certification testing is unique to vendors and clearinghouses in that sense, in that you would only have to complete operating rule requirements that are relevant to your business. So if you're a clearinghouse that kind of acts more as a switch where you kind of just pass the transaction through, you may not need to do some of the data content of the operating rules, maybe more of the infrastructure requirements, such as ensuring real-time testing, or that you can do acknowledgements in that sense. So it's very specific to kind of the business case of how you kind of where in the operating rule and where in the trading partner spectrum you are. And again, the seals are specific to the different phases, phases 1, 2, 3, and 4, and you can get certified on all those phases as of today.
Thank you, Taha. And I would also like to thank Christine, Bernadette, Kat, and Kathy for talking to us today and presenting. The information was extremely helpful. Unfortunately, we are out of time. On slide 31, I'd like to share some information about the benefits of becoming a core participant. And once you download this information, you can look at this a little bit more closely. On the next slide, I'd like to let you know that CAQH Core is going to be at the NABP conference in about a week and a half. We will be working in the exhibit hall, so please come by and say hello and introduce yourself if you happen to be there. In the following slide, we are sharing some conferences that are Endetic conferences. So as you can see, there's one coming up next month as well as next spring. So once you receive these slides, you can click on those hyperlinks and find out information about the conference, including registration information. And on slide 34, as our last slide, I'd like to thank you for joining us today. And you have that information there for our website and as well as our email. If you have any questions or comments, please feel free to contact us. Have a great afternoon, or if you're in the West Coast, have a great late morning. Thank you. Bye-bye.
Thank you.
Bye-bye. Thank you.